It's something we've all talked about this holiday weekend with family and friends. Florida could surpass 1 million cases of coronavirus as early as tomorrow.
Yeah, in fact, the Department of Health added more than 7,300 additional cases today. That brings our total to more than 992,000. The number of lives lost in the state is now approaching 19,000. 8 News Justin Shecker joining us now live in Tampa tonight with a look at where we are in this pandemic. Justin?
Ron and Mel, good evening to you. For the first time since late August, more than 4,000 people in the state are hospitalized with COVID-19. Doctors are better prepared now, but this state is still seeing the highest number of new cases since July. Tonight, we are taking a closer look at how we got here. Florida reported its first 2 confirmed cases of coronavirus on March 1st. Both in the Bay Area.
The only reason we don't have a lot of positive cases is we don't have the ability to test on a large scale.
Schools closed. Students started learning from home.
I don't need anybody worrying about makeup time at this time. I need you to worry about your family and your loved ones.
Restaurants could only stay open for takeout.
We have to do this to try to contain this so that way Florida and the restaurant industry can come back.
I think there's a lot more people that have this than you realize.
Our nation in crisis has now become the global leader in confirmed cases of the coronavirus.
By April, Florida and the entire country began to stay home to slow the spread. Hospital workers continue putting their lives on the line to care for COVID-19 patients.
I'm really emotional. I feel like crying because it's so amazing how everybody works together.
As the medical fight continued, the economic battle raged on as unemployment claims overwhelmed the state system. Frustrations grew.
Well, I think it's time for us to reopen the economy again.
The virus swept through nursing homes as helpless family members could only watch from a distance.
It's a horrible way to die, and to die without your family. I don't know how people are doing that.
By June, Florida entered its second phase of reopening.
No, we're not shutting down. We're going to go forward. We're going to continue to protect the most vulnerable.
Governor Ron DeSantis resisted calls for a statewide mask mandate as cases surged over the summer in the Sun Belt. In the meantime, more families experienced heartbreak.
They were crying like I was crying, like they had lost their mother too.
At the end of September, the governor lifted all statewide coronavirus restrictions. The curve went up again in October.
It's called community spread for a reason because it tends to spread into all members of the population. So the reason why we're seeing these spikes in cases is not because we're doing more testing.
Now Florida is poised to become the 3rd state in the nation, behind California and Texas, with 1 million infections.
Before, we didn't know what to do. Now we know what to do. We just have to sort of have the collective community will.
And doctors remind everyone.
Wearing masks will decrease transmission.
As will hand washing, social distancing, and avoiding large gatherings. The governor, avoiding news cameras, says he's focused on getting promising antiviral medications into hospitals and preparing to distribute a vaccine.
These breakthroughs represent probably the greatest rays of hope that we have seen.
That ray of hope, a full vaccine rollout, which could still take months. And then a new challenge, getting people to take it. And Tampa General is one of the first 5 hospitals in this state that will receive shipments of the vaccine. We should mention we're still waiting on an authorization or an approval from the FDA. The priority will be to get those initial doses of the vaccine to healthcare workers, nursing homes, and first responders. We're live tonight in Tampa. I'm Justin Shecker, 8 on your side.